Good morning, students. So today's lecture topic is breathing exercises. Introduction. Breathing exercises are a form of exercise that can be used for a variety of health-related reasons. For example, to enhance the respiratory system by improving ventilation, strengthening respiratory muscles, make breathing more efficient, and for stress reduction. Improper breathing can upset the oxygen and carbon dioxide exchange and contribute to anxiety, panic attacks, fatigue, and other physical and emotional disturbances also. Deep breathing exercises. Deep breathing helps to relieve shortness of breath by preventing air from getting trapped in the lungs and helps inhalation of more fresh air into base of lungs. It may help clients to feel more relaxed and centered. Technique. While standing or sitting, draw elbows back slightly to allow your chest to expand. Take a deep inhalation through the nose. Retain your breath for a count of 5. Slowly release. Slowly release your breath by exhaling through the nose. Diaphragmatic breathing. It is a type of breathing exercise that helps strengthen the diaphragm, an important muscle that helps with breathing as it represents 80% of breathing. Diaphragmatic exercise helps to make people feel relaxed and rested. This breathing exercise is also sometimes called belly breathing or abdominal breathing. As you can see in the picture, at the point of inhale, the belly is out, and in exhale, the belly is in. Let's move forward on the next slide. The next is pursed lip breathing. Pursed lip breathing is a breathing technique that consists of exhaling through tightly pressed or pursed lips and inhaling through the nose that with the mouth closed. It is a simple breathing technique that helps with making deep breaths slower and more intentional. This technique has been found to benefit people who have anxiety associated lung conditions. For example, emphysema and chronic obstructive pulmonary diseases. This is how pursed lip breathing technique is performed. In the first step, you have to inhale slowly through your nose, as you can see in the picture. In the second, purse your lips as you would to whistle. In the third step, exhale slowly while keeping your lips pursed. Box breathing. Box breathing can be helpful with relaxation. Box breathing is a breathing exercise to assist patients with stress management and can be implemented before, during, or after stressful experiences. Box breathing involves visualizing a journey around the four sides of a square, pausing while traveling horizontally and breathing in a while traveling up the square and out while traveling down it. This exercise can be implemented in many environments, not requiring a calm environment to be effective. This is how box breathing being performed. Breathe in for 4 seconds. Hold in your breath for 4 seconds. Breathe out for 4 seconds. Now hold your breath for 4 seconds. Techniques. Step 1. As you have seen in the picture, it is shown that breathe in through the nose for a count of 4. Step 2. Hold your breath for a count of 4. Step 3. Breathe out for a count of 4. And step 4. Hold breath for a count of 4. And repeat it for 7 times. Pranayama. Pranayama is used as a technical term in yoga. It is often translated more specifically as breath control. Traditional pranayama was based on various aspects of physical and spiritual well-being, practiced from a seated position. In the modern world where everyone is at their desk for long durations, proceeding with pranayama in motion is a good option and has adaptation for this. This is how you can perform pranayama. Mindfulness meditation. Mindfulness meditation involves focusing on your breathing and bringing attention to the present without allowing your mind to drift off to the past or the future. A calming focus is chosen, including a sound, om, positive word, which means peace, or phrase, breathe in calm, breathe out tension, to repeat silently as client inhales or exhales. The mind and body then let go and relax. When client notices the mind has drifted, they take a deep breath and gently return attention to the present. This is how, in 4 steps, mindful breathing is performed. In the first process, breathe in through your nose for a count of 4. You want to breathe deeply so your breath expands your belly. In the second, at the top of the inhale, when your belly is full, hold your breath for 4 counts. Then exhale slowly through your mouth for 5 counts. Lengthening the exhale helps promote relaxation. At the end of the exhale, hold your breath for 2 counts before repeating the cycle again. Inhale for a count of 5, hold for a count of 5, then exhale for a count of 5 and repeat again. Active cycle of breathing techniques. The active cycle of breathing techniques, that is also known by ACBT, is an active breathing technique performed by the patient and can be used to mobilize and clear acids, pulmonary secretion, and to generally improve lung functions. Once an ACBT has been taught, the patient can be encouraged to use it independently without the supervision of a physiotherapist. This exercise does not require the use of any special equipment. This is how active cycle of breathing techniques work. Step 1. Breathing control. Relaxed breathing. Deep breathing or thoracic expansion exercise, that is up to 3 to 5 deep breaths. Forced expiration technique. Huff, medium or low volume. Coughing. Cough out secretions. Breathing control. Deep breathing exercises or thoracic expansion exercises. Huffing or forced expiratory techniques. The techniques can be modified according to the condition of the patient. Additionally, a manual technique or positive pressure can be added if and when indicated to create a more complex cycle to help improve removal of secretions on the lungs. This may include percussion or expiratory vibrations. Breathing exercises can improve pulmonary functions, respiratory muscle strength, exercise capacity, dyspnea, and health-related quality of life in patients with COPD. Evidence suggests that diaphragmatic breathing may decrease stress as measured by psychological biomarkers as well as physiological self-report tools. Physiologic biomarkers as well psychological self-report tools. Moving on to the next point, that is, evidence exists to support the use of breathing exercises in the treatment of chronic or non-specific low backache. Breathing-based meditation decreases post-traumatic stress disorder symptoms in US military veterans. The way of breathing decisively influences autonomic and pain processing. Deep, slow breathing in concert with relaxation are essential featured in the modulation of sympathetic arousal and pain perception. Thus can be useful in chronic pain management. Breathing exercises for adults with asthma may have some positive effects on quality of life, hyperventilation symptoms, and the lung functions. Thank you.